thank you very much for having me. So let's talk a bit about current drug policies and how prohibition actually potentiates harms. So therefore, we first briefly need to talk about what are actually drugs. I know it sounds simple, but we actually will find out very soon that it's actually not that simple. Then we will briefly talk about the option of regulating drugs. So is it possible? Yes or no? Spoiler alert, yes. Then, of course, we will look into what is currently being done, and of course, what should be done instead. So, what are drugs? So the term drugs comes from the Dutch and just means dried, mostly herbal formulation, either for medical or recreational purpose. So maybe we have to be a bit more, we have to define a bit um, better what we mean with drugs. So usually then we mean kind of drugs of abuse. So what is the definition for a drug of abuse? And how can we distinguish between legal and illegal based on scientific properties of a substance? We can't. There is no scientific definition. If we look at psychoactive substances, what drugs usually are, we see that they have different effects, and they usually belong into those kind of classes like stimulants or depressants, so uppers and downers, or with substances who do something with our imagination, with our feelings, with our perception. There we come into the world of hallucinogens and antipsychotics. Here we see a trend in the recreational drugs more towards the hallucinogenic, and the antipsychotic being more used in the medical field. But there are, some outliers there. And stimulants and depressants are used in both, or you find them in legal and illegal drugs, although this terminology is not quite well suited, because drugs are actually not illegal or legal. It's usually things like possession or growing drug plants, etc., which is a crime, and the substance itself does not have any legal status. And what we can also see in this picture is that there are also a lot of interesting substances which combine different effects. For example, which combine the effects of hallucinogens and stimulants. For example, if we look into MDMA, ecstasy, this is a nice substance which is more or less in the middle of these two classes. So just based on the effects, we cannot distinguish between legal and illegal. So here I have some examples, some legal drugs in quotation marks, on the top, and some illegal ones at the bottom, and they're all over the place. So the effects actually do not have anything to do with the distinction. When it comes to harm, I'm pretty sure you all know this famous figure from David Nutt and his study, which is actually based on a study in the UK. We see actually that the most harmful substance for individuals and others is actually a legal one, alcohol, and the least harmful one, magic mushrooms, or psilocybin-containing mushrooms, is the least harmful. So the harm potential overall is probably also not what is distinguishing between legal and illegal drugs. So maybe it's the addictivity, so the chance to get hooked. I have here some more or less important drugs, and like tobacco, heroin, cocaine, alcohol, cannabis, and LSD, and just comparing, how much percentage of people who try this drug at least once are developing a substance use disorder. That's the the PC wording for addiction. And also, here we see the same, that we have illegal drugs like LSD, which even has anti-addictive properties. And on the other hand, one of the most addictive substances, tobacco or nicotine, is really on the top and being legal. So just a few examples that it's not based on any science. So the distinction between, what's in the Misuse of Drugs Act or the Betäubungsmittelgesetz or the UN schedules, it's more culturally coined to avoid the term racist and other discriminatory expressions. So there's one definition which I hope a lot of people will remember at the end of this talk. So the main, if you really want to break it down to a definition, what a drug is according to the law, then it's that. Drugs are what other people take. So usually a majority arguing that what a minority takes should be banned. And of course, we all know the history behind that, which is not that pleasant. But this is something we have to keep in mind because this is still the current law. So drugs are what other people take. So, but can drugs be regulated? And there again, we can learn. Yeah, coffee, tobacco, and alcohol were temporarily banned in some regions in Europe and America. I mean, alcohol prohibition is probably the most famous example, but also, and Al Capone and the associated crime, and people got poisonings with TOCP, etc. But also, a lot of people are not aware that, for example, coffee was banned in current Germany in the 18th century. And funny thing is, the argument why coffee was banned was very close to the arguments why cannabis is banned. So physicians in the 18th century actually said that coffee makes you highly addicted, and that it will destroy your nerves and makes you um, psychotic, paranoid, etc. They of course use some a bit more older, ancient wording. But even drugs which we think are probably quite difficult to regulate are possible to regulate. And a famous example would, for example, be the British system or the system in Switzerland, where you give heroin to people who have a heroin addiction. This is called heroin-assisted treatment, HAT. And this is currently done in multiple European cities and quite successful because um, less acquisitive crime, better healthcare, and those people do not suffer or they don't die from overdoses. So even substances like heroin can be regulated. And of course, cannabis, which is everyone currently is talking about this. I mean, in Germany, it's a big topic because we're actually planning to have a fully regulated cannabis market. Of course, we can see this in Canada, and we see that it works. We see that over time, we see that the legal market is growing and the illegal market is going down. Um, the figure is not the most recent one. From a talk, I think last month, I heard that currently it's the legal market is about 70% and the illegal market is about 30%. So it's possible to regulate. And we have to keep in mind, even if 70-30 still not sounds ideal, um, I mean, while the black market in Canada is about 30% for cannabis, we have to keep in mind that in UK and in Germany and a lot of other countries, it's 100% black market with all the associated uh, negative consequences. The two most stupid things to regulate drugs are either a complete prohibition with law enforcement on the one side, and of course on the other side, a completely neoliberal capitalized market, where, for example, tobacco companies even manufacture chocolate cigarettes, so children already get used to how to hold a cigarette. And when they then later on watch movies in cinemas, they see that they're superheroes, that the cowboys are smoking cigarettes, and so they have their customers for the next decades. So this is, of course, also very harmful. I mean, maybe I should remind that more people are dying of tobacco than all illegal drugs combined. But there is an optimum, and the optimum is again somewhere in the middle. And this is a market regulation based on, of course, humanity and evidence. So, and of course, the regulations might differ from substance to substance. So, while, for example, heroin, you might be able to do this with a prescription model. For cannabis, you have so many users and it's so easy to grow. You need a bit more open market, but this could be still, something like cannabis social clubs or shops just for adults, You know, I'm not advocating and selling any cannabis in supermarkets, for example. But on the other hand, I also don't advocate selling alcohol on the supermarket. So we still see that alcohol, although it's not on top on the right side, yeah, because we have certain rules and certain education, but you know, we still have some potential that alcohol can go down more to the public health optimum, so decreasing health and social problems. So just to be sure that we are talking about the same thing, nearly every person has used drugs, full stop. Every third European has used illegal drugs. Again, terminology is not ideal, but I think you know what I mean. Regulation hardly affects use prevalence. This is an important message. Countries for example, countries with harsh penalties, for example, may have increasing or high use prevalence, and countries with low or no penalties may even have decreasing or low use prevalence. They have an example from the MCDDA where they looked at cannabis policies. So, and we also see in Canada, I mean, after legalization, that use prevalence, particularly in vulnerable groups, is not really increasing. And also humanity, being humane, you know, think about, we are talking about our friends and family. Nice people take drugs. I know in recent years a lot of rubbish has been on buses in the UK, but the statement is actually true. So what is currently being done? So the vast majority of people who use drugs do not have significant problems with drugs. So an intervention by the police is considered harmful because we're talking about penalties, we're talking about discrimination, stigmatization, we're talking about traumatizing experiences. Of course, there is a minority of people, and I mean, depending on the substance, this minority can be also, you know, in the subpopulation quite high, you know, 10, 20% um, of a subpopulation with using a certain drug. Um, but even for those, intervention by the police are considered harmful. Intervention by social workers or by healthcare professionals, this is considered useful. And this is why um, this whole topic needs to shift from crime to health. And this is, I think, something very important. And this is also, you know, when people talk about paradigm shift, this is actually the ultimate goal. We have to keep in mind acquisitive crime associated with drugs. Here I have a quick example, just that you know, that you can visualize a bit what's currently happening. You know, beyond illegal prostitution and selling drugs, of course, there's also a lot of you know, theft and other types of crime. And we always forget the price we pay for that. Yeah, if someone, like in this little meme here, is doing 10,000 pounds of damage to get goods worth of £1,000, and then of course selling them on the black market, they only get 100 quid for it. And then what they actually buy on drugs, yeah, this is only worth £10. So a proper, for example, a pharmaceutical or agricultural company would be able to uh, sell this product for 10 euros, although the dealer might sell it for 100 euros. So the difference here, yeah, and this is happening every day. The difference here, this is what society pays. It would be it would be, you know, and the same would happen for diabetes. If we would tell people who are dependent on insulin or metformin, if we would tell them, hey, we won't provide it to you, we would see exactly the same. So we need an alternative for the black market. That's, I think, key. And we also we also need to ensure safe supply. So what should be done instead of the current practice of, you know, criminalizing everyone? So first of all, I think this is content more or less everywhere. I hardly hear anyone who does not agree with this, but decriminalization. So only illegal commercial drug sales should be targeted by law enforcement. But people who use drugs, including their own supply, this should not be relevant for police, for example. But then also, I mean, this is only one half. The other half is we should also try to legalize and regulate the market. This is, of course, more tricky, and this will take many, many years. And of course, yeah, also some people also need to do some brave decisions there. But basically, every major drug needs one or more regulatory models. And these regulatory models can depend on the use prevalence. So how many people are using them? Do I really need to have multiple shops? Or is maybe one online vendor for LSD? Is this maybe sufficient? Because LSD. Sorry, I think my mic just switched off. Can you hear me well?
Yes, we can still hear you, Fabian.
Excellent, excellent. So there are some drugs where, for example, a prescription model might be more useful. There are some drugs where social clubs or special shops might be relevant. But there are also some illegal drugs which actually could be sold in a supermarket. I'm talking about things like, for example, coca tea. I mean, this is not more harmful than coffee. And then, of course, we should more invest into harm reduction services. Drug checking, because even if you aim to legalize and regulate a lot of drugs, there will be still some substances which are not on the table yet, because we are talking about thousands of compounds, and I mean, it's not logistically possible to regulate every drug there is, because there are just too many. If someone really likes a certain ecstasy or psychedelic derivative, 2CI, for example, I mean, maybe there will be a market for 2CB, but definitely not for 2CI. So this person must be decriminalized, and this person must be able to check their drugs. So drug checking. So what, for example, the Loop is doing in UK, very awesome. I think whatever funding they get, I think they need to get more. Then, of course, safe consumption side or supervised consumption side or supervised consumption services. There's so many terms for the same kind of things. Also in this context, of course, needle exchange. So by allowing people to change their needles, you actually decrease the risk for infectious diseases. Then, of course, educating people about drugs. And maybe we should also start with educating the people who are educating about drugs, because I think a lot of people who are currently educating about drugs, though, are actually lacking a lot of skills there. Maybe I'm a bit biased on maybe this is different in different countries, but I think having some standards there and having a best practice there, and particularly interdisciplinary work where people from natural science work with people with social sciences and actually create a good drug education core, that I think would be very relevant. And then, of course, naloxone. Naloxone is a lifesaver. We need to bring naloxone nasal sprays into the communities, so that people can actually reverse overdoses. And of course, if people should not consume alone. So this is again where this, people need to be decriminalized so they can use in a social setting, like a safe consumption site, or in a social club. And then, of course, offering psychotherapy without coercion or abstinence paradigm. So if a person develops a problem with cocaine, they should go as soon as possible to someone offering them help. So from the health sector. And if they then are pushed to stopping their, for example, cannabis use, which does not have anything to do with it, but this actually then leads that the person is not, for example, getting a certain health service, or maybe thinks about, oh damn, they want to screen me, they want me to do drug screening, and they might abstain from the service. So we need to have this low-level accessibility for health services, and this is why it's important not to push for abstinence. And also, it should this whole support, don't punish is a lovely thought, and I'm also advocating for this. But we also have to, if someone is not willing to stop using a drug, pushing them into a health service is of course better than a prison sentence. Yeah, don't get me wrong on that. But this person is then still taking the place away for someone who's willing to quit. And again, no one should need to quit. I mean, there are safe ways to consume drugs. The majority of us is safely consuming drugs. So maybe also in this context, please note that cannabis legalization did not significantly increase use prevalence, particularly not in vulnerable groups. This we, for example, can see in Canada and Uruguay. Then the positive effects just by decriminalization. Again, I'm for decriminalization and drug legalization / regulation, but only the decriminalization, as we can see in Portugal, lowered the numbers of overdose deaths, of HIV infections, etc. So this is something we have to keep in mind. And the last thing I would like to mention is also the practicality. So there are certain drugs which you can actually grow and produce on your own. And I think if countries are not willing to regulate the market due to international pressure or to the complexity, it's actually quite complex to legalize a drug. Then there should be at least a way that people find together in social clubs and can use drugs together in a safe and social setting. So where you can educate people, where you can give support to people, where you don't let people use alone, where you can, for example, if we're talking about psychedelics, where people can then organize, for example, a psyche and trip sitting. So there actually, it's not only cannabis which can be cultivated. Traditionally, all drugs actually come from plants and fungi. Uh, so the exceptions are rather from the last a couple of decades. And even if there are some, yeah, totally or only chemical substances, there are still some plant alternatives. And there's also the ability for pharmaceutical contingents. So not like in the opioid crisis where you kind of leave it to the industry, how much they push physicians to prescribe drugs, and that people tell you that oxycodone is the new ibuprofen. It's not, and it's caused a lot of damage. But within those contingents about what is needed, so what's the demand for ketamine, what's the demand for this and that stimulant or opioid, benzodiazepine, etc. Within this, it's possible to regulate a safe supply without commercial interest. And both are kind of captured together in this analysis called farmability and farmability. So I would yeah, love if some people have a read and maybe spread the word, because social clubs and safe supply is possible, and it's a way forward, and it actually does not need the full legalization efforts. And with this, I would like to close my little presentation, and thank you very much for your attention.